Top Med Talk. Hi, it's Monty Mythen here, Editor-in-Chief of Top Med Talk, coming to you with another episode of COVID-19 from the frontline. I'm at my home in England. I'm off clinical at the moment, and I've just managed to catch up with Desiree Chappell, our US anchor and managing editor for Top Med Talk, who's been in the operating room for all of this week until this morning. Desiree, must be good to have a morning off.
It is, Monty. I finally was able to sleep in a little bit and get some rest, which was much needed. It's been a very stressful, really month, but things have ramped up so much here in the last week and a half, 2 weeks, and I have been in the OR quite a bit. The biggest fear is just of the unknown.
Yeah.
Heard a lot of people describe what, the COVID crisis, the pandemic that everyone's been talking about in the news as a tsunami, that we're all standing on the beach and we're watching this giant wave come. We don't know if it's actually going to hit or if it's going to, peter out before it gets to us.
Well, that's an interesting analogy, because when I spoke to Hugh Montgomery earlier in the week, one of our podcasts, his description of London, of the tsunami, is, the water has just emptied on the beach. So we're sort of standing there thinking the tsunami is coming. In other words, we've got that chill in the air, that stillness. We can see that big wave on the horizon now because it's all happening here. It has all kicked off in the UK.
Yeah. From just our conversations that we've been having, it seems like we're in similar situations. I mean, in our facilities here in Louisville and in Kentucky, our governor is giving us daily updates. He's done an amazing job about keeping the people of Kentucky informed. And so just as he was giving his daily report yesterday, I think they added on three or four more cases within the short time of just an hour. And so I think we're, as of last night, up to 35 cases in the state confirmed. In the state. What's really interesting, geographically, they are spread from east to west, side, north to south. So there's no location that is concentrated. It's just kind of smooth. Now, we have some bigger medical centers in Louisville, Kentucky, in Lexington, that we are seeing just slight few more. But yeah, it's all over. In the facilities where I've been working, we have known patients. We started doing surgery on known patients. Whether or not we were prepared for the big wave, I think it's going to be hard to tell really what the level of preparedness is or was until we kind of get further into this. But I think what the biggest thing is that people are really starting to realize this as it's actually happening. So that's where we are.
If I may, Desiree, can I just run down the checklist of the things we're getting used to and see where you are on the spectrum locally now? So kids at school, not at school.
Kids are out of school.
Okay. Challenging, I'm guessing.
Absolutely. Yeah. A lot of homeschooling's going on. Yeah. I've seen, so obviously, we are in the social media space so much anyway, but my favorite meme is that after one day of homeschooling, we feel like we should be paying teachers about $1 million a year.
Right. Someone write that one down.
Yeah.
Okay. So it's interesting how these ideas get forgotten extremely quickly.
Absolutely.
We need to start a log of all these things that are sort of being promised at the moment that will almost definitely be forgotten straight afterwards.
Straight away.
So teachers very, very highly valued. So they've sort of closed our schools here. They're closing them tomorrow, but they've taken this interesting approach, which we're not quite sure how it's going to play out yet, where they're keeping the schools open for what they've deemed to be the list of essential workers. Now, because otherwise they're going to restrict the availability of the workforce, and the alternative is to ask mama and papa to look after them, which is not a great strategy.
No.
And we're not quite sure how that's going to shake down. What is interesting is to look at the list of essential workers, and it's really interesting to note who's not on that list, if you see what I mean.
Yeah. Who's not on the list?
You can guess. We're on the list. The workers are on the list, if you see what I mean. You're on the list.
Yeah.
I don't want to call out too many people, but, investors, bankers,
the
ultra rich, the super rich, blah, blah, blah. But that's, great. But let's just be, we don't want to brag about this. We're the ones who are going in there. But the list extends down to all those people who keep the hospitals going, which includes the plumbers, the electricians,
absolutely,
the people stocking the shelves, the cleaners. Exactly.
Yeah, it's everybody. And, what's interesting, I was talking to my husband about this, and whenever we've been through, financial crisis in the past and, the people that are needed, I mean, it's always been kind of this thing that hasn't necessarily affected healthcare, and we just keep doing our jobs. And I felt like the financial people have been essential. The bank's essential, but at this point, like, we are the frontline providers, and it's going to be interesting how we manage the workforce and how we protect the workforce and how we maintain it and sustain it through the crisis. I don't know how that's going to happen, but those are all the things I'm thinking about.
I know my clever friends will tell me that and they're right, that the investors are important and the money in the economy is very, very important, but you can do all that from home. You can do that remotely. So yes. This is a reflection.
You don't have to have face to face
of who needs to be able to move around. Now it is eerily quiet here. Now, you often joke about the fact that any journey in London in a motor vehicle takes 1 hour.
It's my rule.
It don't at the moment,
so,
which is a bit eerie.
Yeah,
almost everything is shut down. We've got this weird rule whereby we strongly encourage the pubs and the restaurants to close and people not to go to them, which is a bit of a fudge, because if you're running one of those things, that impacts your insurance, etc., etc. Yeah. But that will all sort itself out. What about you? Social distancing going on locally?
Yeah. Yes. It's been, it's being enforced in some ways. We have shut down bars and restaurants, I believe, closing, or they're not closing. They're closing for in restaurant dining, okay. But they're still doing takeout. Delivery business is up. Of course, all that's going to be impacted as this goes on. We have, every government building shut, libraries. They've now shut down movie theaters, anywhere where there can be gatherings over about 10 people. What else? We have...
the president decided it's not a hoax. That's a positive move.
It is. It's good. It's good. I think, honestly, one of the things that we are fighting, at least in my community, and I can say what I've heard on the news, but I know for a fact in our community, what we're dealing with is there are a lot of people that, with some disinformation and misinformation early on. Now it's very difficult to change their mind. So they've kind of heard one thing.
The stuff I've been watching on the Fox News clips, it's just a cold, it's just influenza, it's made up by people, it's just a hox. And
and it wasn't just soaked in. To be fair, it's not just on Fox News. I mean, there were...
Sorry, that's just the stuff that I've seen on the internet.
Our government was saying that for weeks. And so that's what a lot of people heard. So I know I heard it all day long, every day in the ORs about not going to be a big deal. Our patients have not been overly concerned about coming in for elective cases into the hospitals. So I think it's affecting everyone. Obviously, the big story now are the millennials that are still spring breaking, which I don't know if that translates well across the world, but
I think if people want to go online, they'll get a sense of it.
Yeah,
it's a big pent up energy release, isn't it, every year?
It is.
Which is very hard to suppress.
It is. I mean, these young kids at university and college working hard, and they look forward to a week break that we always have in the springtime. And many of them, travel and go somewhere with their friends and just kind of party. And, in years past, great. When we're trying to reduce the transmission of a very serious virus, it makes for kind of a disastrous situation, especially when this is so contagious and many people of that age are asymptomatic. So that's a big story here. So millennials, I have a lot of friends who are like, these millennials are killing me. I always kind of turn them back around that a lot of our parents and grandparents are kind of stubborn too. And so they want to get out there and no virus is going to stop them. And again, what they've heard in the media and from our government earlier on, that's kind of stuck with them. So they're still going out. Our governor had to shut down bingo and any kind of social situation for gambling because the bingo halls, which is a thing, which I don't know if you understand bingo.
Yeah, we do. Well, we do in the UK. That's but it's a great important social gathering and a bit of brain stimulation. And
absolutely. And it's great. It's like bridge clubs and, all these other card playing clubs. The governor had to shut them down because people were still going to them. Our highest risk population. Kentucky, I think, is the third state in the U.S., the highest morbidity and, kind of the sickest patients in the U.S. And so it's real. I think things have really changed. Everyone's changing their tune here in the last week or so. For me personally, the biggest thing is seeing that the governor, he hasn't mandated, he strongly suggested at this point that all elective surgeries be canceled or postponed.
Right. Yeah.
And the big debate right now, and it's all over social media, is are surgeons going to make the right choice and determine which cases are truly elective versus urgent versus emergency? And anesthesia providers for that matter. And ultimately the patients, they have to decide. One of the big conversations that we had for our patients is if a 65-year-old who's generally active but having major knee problems has their surgery scheduled, to them, that case is still urgent. They still want to have that. And so it's an honest conversation that we have to have with each other as providers and then with our patients to determine that.
Basically here, as far as I can tell, if it's not scheduled, i.e. relatively emergent cancer surgery or urgent surgery, it's just not happening. People in many parts of the world have to wait a long time with painful knees. It's an important contribution to this whole challenge. What we're trying to do here is not overwhelm the health system. It's not about the possibly inevitable transmission between each other. It's the when you get it is the component of it. So the mindset is all about what can I do not to give it to somebody, not what can I do not to get it.
Yeah. For many of us healthcare workers, it's not a matter of us getting it. It is the transmission, especially if people are not prepared when it comes to donning and doffing and, universal precautions. We typically use them, but I think that people get lax. I think even in this crisis, I've seen people be a little bit more lax than they normally would. Now, another major issue that I heard people quote all day long, every day, was that we're really concerned that we are going to run out of PPE. So if you're seeing that on the news as a personal protective equipment, if you're seeing that on the news, it is true. It is very real. And in the ORs where I've been, in the hospitals where I've been, we're trying to figure out what are we going to do when we run out, because there are limited supplies.
And if we do certain surgeries that could be postponed, that creates enormous pressure on it. The other thing is you've got a reasonable chance that you'll get a new knee and COVID-19 as a bundle.
Absolutely. They're the highest risk population. I mean, obese, elderly with comorbidities. Those are the patients that we take care of, especially here in Kentucky. Now, you might be doing something a little bit different in outpatient centers, but it's a true concern. And then if we're doing these major high-risk patients and they have to be in the ICU and there's not enough places to cohort everyone because we are taking every available bed for COVID patients, it's going to be scary.
So on the first one, I think the good news is that the public health communication is such that even if surgeons say, I can squeeze you into your knee, the patients here are turning around and saying, you must be joking.
Yeah, no way.
No way. I'm not going into that hotbed of COVID-19 until you've got your testing right up and your PPE is fully available. Time out. I've waited this period of time often for many years while it's developed. I'm okay for a while. And then the second one is, how do we provide the appropriate care for the patients who do need their typically scheduled cancer surgery? Mm-hmm. And that, with the pressure on beds, is where a lot of people are starting to think outside the box. There's not only the acceleration of the enhanced recovery principles, because, why wouldn't you do enhanced recovery now? This is your moment. Why wouldn't you do that? Accelerate recovery, reduce complications, prepare people properly, reduce readmissions, reduce ICU bed availability. Get out of a COVID-19 rich environment as quickly as possible. Why wouldn't you do that? And also, why wouldn't you create a separate space which is not all about mechanical ventilation, but which is about high levels of monitoring, the sort of ARC type of stories we've been hearing about, overnight intensive recovery, that can deliver everything aside from the mechanical ventilator, which for most cases you don't need. There are very few cases that truly need post-op venting, are there?
Absolutely. As I was leaving yesterday, talking to colleagues about trying to figure out where those places are. I mean, we have a lot of hospital space. It's kind of like, how are we going to designate those areas for the patients that are non-COVID, which at this point, testing is still not up to know exactly, but our surgical patients that we know we're going to have to do surgery on, let's send them to a completely confined unit and cohort those patients, and then just assume everybody else has it. That's what I was asking about yesterday. So,
And even so, if I may say, even if we may take one of our smaller hospitals and make it a purely scheduled cancer surgery, but initially we are going to treat everybody as though they've got COVID-19.
You have to,
because you've got no other. If you look at the learning from the rest of the world, you've got no other way of telling it until you've got the testing fully embedded and fast. So you have to assume either they've got it or you've got it, or the people around you have got it. There's no other way of doing it. Many people are asymptomatic. That's pretty clear.
That's true. I was really concerned we were still doing screenings for people. Have you traveled outside to the US, to Italy or China as of Monday? And it's like,
it's an irrelevant question. The question they're asking now in China, they're saying, have you been to the USA? That's it. That's the. I don't know if you saw today. There are 0 new COVID-19 cases in China. The only new ones they've had are for people who've come back from other countries.
Wow.
And I have absolutely no reason at all to believe that our Chinese colleagues tell us anything other than the truth when it comes to these medical data. That's why it's published in the New England Journal of Medicine, the world's premier journal that is out of Boston, Massachusetts. So, well done for them leading the way. Yeah. I noticed that on the curves that South Korea has stood out as taking the edge off the curve quite dramatically compared to almost anyone else. All the rest of us are in a pack now, running up on the China line and the Italy line. They almost exactly overlap. And the USA is accelerating up that line and is actually still ahead of the UK with regards to its, where you are up the line. It's just your population is so dispersed, there's not a lot of people maybe not feeling it yet. They certainly are up in Manhattan as far as I can see in other parts of the...
I want to come back to the enhanced recovery thing in just a second, Monty, but since we're on the idea of testing right now, I know that for us, we are really ramping up our testing. So it's inevitable that we're going to see a very sharp rise in our cases. I mean, it's there. Many governors here in the U.S. are already saying that it's likely. I should have said
this is the death from COVID-19 curve, from confirmed COVID-19. So on the positives, I think our governments have all stepped up to the mark now. They've all listened, which is great. It's our colleagues are all being fantastic. Most people are starting to take it very seriously, and the people who aren't taking it seriously, the community is starting to sort them out. They're starting to say, "Hang on a second, whatever it is, off the beach, back home, out of the bars, stop the bingo." So I think the communities are starting to appreciate, as they've seen their own loved ones or friends or family get affected, that it's real. And the data we've seen now is there's, with the exception of very young children, once you get to teenagers, nobody's protected. This idea that the young don't get it is not true. Yeah. It just seems the young don't seem to get it too badly, and it's still the older, more vulnerable people that are at greater risk. There is a great summary paper out from China, the first sort of big wave of looking at signs and symptoms and who gets X and Y. It's worth having a look at. So back to enhanced recovery, Desiree.
I think for us right now, it is the prime moment to be having the conversation, because we're probably going to be another 15 to 30 days before we see our major wave of patients.
The uptick,
the uptick that are in the hospital requiring intensive care. And so I'm sure that there are a lot of patients that we're going to be trying to push through to get some of these surgeries done. And they're high risk. We need to do whatever we can to get them up and going and out of that hospital as quickly as possible. I really want to focus on Top Med Talk here in the next week or so about talking more about enhanced recovery with our providers, our surgeons, our anesthesiologists.
Yeah, because as we know, many centers in the US, they do it now. Almost all forms of major surgery, particularly the major non-cancer surgeries, but including many of the cancer surgeries, can almost be done as a day case.
Almost. Yeah.
So people, I was looking at data, people have still got length of stays of an average of 8 days. I said, what is going on? Come on. Stop the denial. It's a bit like the denial of COVID-19's not happening. It's not going to happen. It's happened. So take this opportunity as a clinician to turn around and say, I've actually been dissing this enhanced recovery thing for complex reasons like I'm close to retirement, or I don't understand it, or I don't want to do it. Just take a deep breath now and say, this is for everyone. We're all in this together. Probably going to have a bit of time. Read the literature, learn about it, ask someone to show you how to turn the machines on, how to mix the drugs up. It's okay. There's lots of us having to learn how to cross over tasks. There's lots of us having to go into uncomfortable spaces, which means we need highly protocolized care packages. You know, I live in intensive care mainly. My anesthesia colleagues are coming across to provide the buffer in the numbers. They're a little bit nervous about going back into that environment, but they'll listen and they'll learn, and they're perfectly capable of doing it, if you see what I mean. So we know from the surveys that a lot of the resistance to doing it is just kind of like, not today. And the other thing is, to be quite honest, I don't know what you're talking about and I don't know how to do it. And that's hard to admit in public. But you don't have to now, because we've got a global pandemic crisis. So, you know, get over it. So you work at, everyone's going to be pushed to the limit of their capabilities.
Yes.
Everything's got to be highly protocolized, because
and highest level, like of the best care that we can do.
So you've got to accept high degrees of protocolization. Your personal variation in your order sets, you know, get over it, because we can't cope with that in the moment. And it really doesn't matter. You might have had the greatest idea ever, but we can work that out during this process. Just accept degree of standardization, protocolization. Let's get on with things. We are all in this together. Chilling thing is, if we are sloppy about this, we as healthcare providers are in no way, shape or form protected from getting COVID-19. Actually, we get it more often. So the sloppier and the more pig-headed our colleagues are, the more of us and or themselves they will take down.
Yeah. Again, with the lack of PPE, with the high-risk patients, and especially for anesthesia in critical care, I mean, we are in their airways, and there are definitely steps that we can take to mitigate the transmission. But I just really feel like we're at extreme high risk for contracting it, and we're going to be exhausted. I mean, I think I've worked 3 days in the OR without COVID patients, and I'm just exhausted from the stress of it, and so that puts you at higher risk.
So we need to get our donning and doffing kits. We're obviously not going to use equipment that works, if you see what I mean, but you can make up your own kit at home. Of various different things, you know, for things you can buy in the DIY store. And practice our routines. So
that's right. It's true.
Donning and doffing, and watch each other.
Watching the YouTube videos. We should probably put a link up. There's a million of them out there. But you know, Monty, one thing that I wanted to say, my mom, she is a dedicated listener of Top Med Talk.
She's a clinician.
She is. She's a nurse. We've said that before on Top Med Talk. She actually works for the state health department and surveys nursing homes. And so she's a shout out to Dottie. Hi, Dottie. She is really concerned, like, you know, you hear all over the news that they don't really have any protective gear at all.
Wow.
They don't have N95s, very minimal. And
come on, you gotta sort that out.
It's scary. And what they're concerned about are the employees, the residents. They're not going in and out of the facilities. It's the employees that are. Have
you not had a lockdown on that? As were many of them locked down well over a week ago, nearly 2 weeks ago.
Well, they're locked down for visitors, but the people who have their children to take care of at home still have to go home. No,
I mean a lockdown including full protective approach to
Well, I mean they're trying, so that's what they're doing, but they're already starting to run out of protective equipment. And so my mom and I were talking, and she wants to create an initiative. And
this is
so it's corny. Brilliant. But, you know, there are a lot of people sitting at home, especially their retirees that, you know, may have all kinds of kits and things that they can use to make surgical masks and protective gear, because it might come to that. Maybe it not, and hopefully it won't, but it will give people something to do. And there's a lot of those YouTube videos too. And, you know, it might be something that those particular facilities may need. You know, in the hospitals, we might be a little bit more prepared than the nursing homes.
Well, that's been happening around the world. As you say, there's lots of wonderful examples of seeing people say, well, actually, you know, what are we going to do? I'm a little bit bored. Maybe I'll make some masks and stuff.
Yeah.
So it's all doable. Right, we better wrap, Desiree, because we've been chatting for a while and we've got to get some other guests on later on. We're hoping we can catch up with some other practitioners around the world, but certainly, you know, as the days pass, we don't want to have too much of this. We've got to flatten the curve on this conversation a little bit as well. So we'll at least have one person from somewhere different in the world every day of the week going forward. Yeah. And we've got lots of other cool plans that we're going to be working on today to continue to bring people COVID-19 education, enhanced recovery education, overnight intensive recovery education, and a trickling background of our CME for people when they think, well, actually, I still need to continue my general perioperative education. So providing we stay well and our energy levels are up, Top Med Talk, we're all over it.
Absolutely.
Thank you to our very generous sponsors, in particular Edwards Life Sciences. Thank you to our employers who are who have worked out wonderful rotas that mean we're going to be very, very busy. But in between those very, very busy days when we're not cross-covering, we can do a bit of this.
Yeah, absolutely. We appreciate all that. Please don't forget to check us out on social media. Tag us if you are in a particularly interesting thread or see an interesting thread on Twitter or Facebook, LinkedIn or Instagram. Tag us, and we'd love to look at that, look at whatever you're looking at if you find it interesting. And make sure to please check us out on topmedtalk.com. Be sure to just keep checking in with us. We're going to try and stay up to date as much as we can on everything and have some great conversations. And we'd love to hear from you. If you're interested in chatting, send an email, contact, CONTACT @topmedtalk.com. Thanks for listening.
We'd love to hear from you.
Top Med Talk.